Hello, everyone. My name is Emily Hosford. I am an occupational therapy doctoral capstone student. And today we'll be going over autism and some of the feeding challenges associated with autism. This is just one of the videos of a series, and this video specifically will be looking at an overview of autism and how that may impact feeding and some of those common feeding challenges. The objectives of this presentation is to recognize autism-specific challenges related to feeding. It is also to understand the long-term goals of addressing feeding challenges for autistic children. To start off, we're going to review some of the common traits of autism, just as a brief overview. While every child is different and autism is a spectrum, there are some common traits and themes that come up that impact feeding, and it's important to be aware of. So the first one is a desire for sameness and routines. This is specifically related to that diagnostic criteria of repetitive and restrictive behaviors. Along with that, there can be inflexibility to changes. Also, many kids with autism have sensory processing differences, and we'll dive into that a little bit more later and in a different video. And then finally, some autistic children have delays in communication and delays in motor skills. So some of the common autistic mealtime challenges are food selectivity. This can be eating little variety of different foods or being very particular in needing food to be a certain way, a certain type, a certain brand. They can also play with food, eat food very slowly. Another one is requiring food to be presented in a specific way. So like I said before, needing a certain brand, needing a certain bowl or utensil or cup. Along with that, there can be stuffing mouth or cheeks, gagging, leaving the table or having a hard time getting your child to the table, and then engaging in disruptive behaviors. So this can be tantruming, swiping food, crying, anything that would be disruptive towards a mealtime. While these are some of the common ones, a lot of what we see for mealtime challenges is food selectivity and mealtime behaviors. So a lot of these presentations are going to be focusing on that, but also acknowledging that there can be so many other mealtime challenges associated with autism. So how does autism impact feeding? First of all, the sensory components of eating can make feeding very hard. Like I said, there will be another video that outlines the sensory components of feeding and provides some tips and suggestions related to that sensory aspect. But feeding is a lot more sensory than we think, just based off of the naked eye, and it can be very difficult and complex once we look at it further. So change is difficult for autistic children, and eating the same things allows for consistency and predictability. Behaviors at meal times are also a form of communication that your child isn't ready to try something new. They're not engaging in these behaviors on purpose to be disruptive and cause a scene. It's more that they're communicating in the best way that they know how, that they're not ready to try something new, and it can be overwhelming. So really thinking about all of those traits that we talked about and how they may impact feeding, such as change in sensory and all these different components. So feeding is more complex than we think, and and autism can make it a lot harder. So what are the goals for feeding? I'm going to move myself over here so we could see the slide. But the goals for feeding challenges, whether that is in feeding therapy or using strategies at home, would be to find lifelong strategies that help children feel safe in their bodies, especially during meal times. So like we were mentioning before, behaviors can be a form of communication that they're not ready. So it should be finding ways that we can change the environment or change the way we present foods that create lifelong feeding habits. It shouldn't just focus on right now, but it should focus on the child as they progress through life. So having a healthy toolkit to feel safe during feeding, that's the biggest goal. Another one is to progress towards adequate nutrition and having enough variety to prevent burnout. So being able to eat enough variety of foods that they could not lose any preferred foods either. Another goal could be exploring what sensory parts of food your child enjoys or avoids. So thinking of those lifelong strategies again, being able to identify what textures, what tastes, what smells and temperatures that they enjoy or they don't like, so they know what feels safe to explore in the future too. I want to recognize that goals for feeding is for the child, but also as the family as a whole. Your family unit is important, so a big goal would be to reduce stress at mealtimes for everybody involved. And most importantly, the goals are not to get your child to eat everything. Adults don't even do this. I don't even eat everything. So having realistic expectations of what goals should be and realistic expectations around food as well. So speaking of the different expectations around food, these are really important points to consider that may help reduce stress for everybody involved too. So one, there is no right way to eat. Everybody's body is different. Everybody's body has different needs. So there's no one right way to eat that fits everybody. So strategies should look at what is beneficial for you as a family and what is beneficial for your child, and finding those lifelong strategies that make it beneficial for them to eat. So there's no one right way to eat. Because there is no one right way to eat, there are different ways for your child to get nutrients besides raw fruits and vegetables. Raw fruits and vegetables can be very hard for autistic children. So thinking of, can your child take a multivitamin if you're worried about nutrition? Can we blend them up into smoothies? Being creative and finding a way to get nutrients that works for your child is going to be best. And it doesn't have to be what society tells us, per se. I also like to remember that our hunger levels and our eating patterns change every day. So one day we may be hungrier than the next and eat a lot, and the next day we might not be as hungry, or we'll eat a lot of protein and then not. So that's okay too. If we look at food groups throughout the entire week rather than the daily, that can be helpful to reduce stress and reduce our expectations around food. And if you take away anything, any food, including safe foods, is better to eat than no foods. So always offer foods that you know your child is going to eat. Make sure that they have something to fill up on at meal times. Any food is better than no food. So here are some resources that may be beneficial if you're looking for more resources. This podcast is great. You could listen to it wherever you listen to podcasts. This podcast specifically looks at the different ways that we can view eating and changing our expectations to help reduce stress. These Instagram accounts, the first two, Feeding Littles and Feeding Picky Eaters, is for children as a whole, but the next two, Autism Dietitian and RDS for Neurodiversity, are more specific for autistic children. And then this book, Food Refusal and Avoidant Eating in Children, was very beneficial if you want more background information and more connections between how autism may impact feeding. And there's some tips and suggestions in there that may be helpful. Here are the references if you want more information. But thank you for watching this. Please check out the other two videos that are on sensory components and mealtime tips. Thanks again for watching.